Awarded more than £60 million, the National Institute for Health and Care Research, Manchester Biomedical Research Centre, brings together world-leading researchers based at 6 NHS trusts and the University of Manchester to drive health improvements and lasting change for all. Transforming scientific breakthroughs into new diagnostic tests and life-saving treatments, we deliver cutting-edge research to improve lives within 13 different themes grouped into 4 clusters. Let's hear from Professor Emma Crosby about what our researchers from the Cancer Cluster are working on.
So the Cancer Cluster includes 4 themes. There's the Cancer Prevention and Early Detection theme, Cancer Precision Medicine theme, Advanced Radiotherapy, and Living with and Beyond Cancer. The 4 cancer themes work together by spanning the patient journey between trying to reduce the risk of cancer through both lifestyle interventions and medicines and surgery to reduce cancer risk, through to diagnosis of a cancer, streamlining that process, developing novel diagnostics, and then really looking towards how we treat that patient based on their cancer and their characteristics, and all the way through to how to improve their survivorship. So they really span that cancer pathway, all the way from risk through to living with and beyond cancer. In Manchester, the research that we're doing has both local, national and international reach. In terms of local reach, we are really engaging with our communities to ensure that everybody has access to our research and can take part as much as they're able to do so. So, for example, we are taking research out into socioeconomically deprived communities through a research van, and in this way, not only making research accessible to those communities, but also really ensuring that any results that we develop are then broadly generalisable to those communities in the future. In terms of national reach, some of the projects that we have pioneered here in Manchester have led to national policy change. For example, the targeted lung health check, whereby lung cancer screening is taken out into socioeconomically deprived communities, has now been rolled out as a national initiative. But this research is also of international interest because it helps other countries to design their programmes to help reduce the burden, for example, of lung cancer across the world. We were recently awarded the American Association of Cancer Research Team Science Award in San Diego for the work that we did bringing Lynch syndrome screening to everyone with a new diagnosis of womb cancer. This is an example of how teams working together can really produce outstanding results that make a difference for patient care. Researchers across the 4 cancer themes have the benefit of working together, from learning from each other, sharing best practice, working out how to best engage with industry, for example, working with patients and communities, and also trying to develop our next rising stars in cancer research. We have a very patient-centred approach to research here in the cancer theme. So, for example, for the Cancer Prevention and Early Detection theme, we carried out a James Lind Alliance priority setting partnership where we went and worked directly with communities to find out what they thought were the most important research priorities for detecting cancer early. In the Cancer Cluster, we're doing really exciting research that promises to make a difference for cancer patients in the future. We're developing a blood test that can identify patients at increased risk of cancer recurrence and in whom different treatment options may need to be offered. We're looking at different ways of improving radiotherapy, that is to direct the radiotherapy directly at the tumour and avoid some of the collateral damage to adjacent organs. And we're also looking at identifying people at risk of second cancers. For example, people who've already been treated for lymphoma are at increased risk of lung cancer as they continue their survivorship journey. And we're looking at ways of introducing lung cancer screening for those people. So lots of really exciting research that we are really hoping to generate practice-changing results in the future.